morning. My name's Karen Mellanby. I'm Director of Networks and Communities at Mind, overseeing our sport and physical activity work and programmes, and I'm really pleased to be here today to chair this conference. Our first ever mental health in sport and physical activity conference, and it's lovely to see so many of us here in person after so long. I do actually have shoes on, not slippers, for the first time in a while. But we're also joined by 400 people joining us online, so it's another first really. It's our first hybrid conference. And it's fair to say it's been an unprecedented year and a half. Thank you to all of you who have stayed with us through the rescheduled dates. Here we are, third time lucky, and back where it all started, the Kia Oval. So for those of you who have been involved and supported our work since the start, it was here in 2015 that the Sport and Recreation Alliance, the Professional Players Federation, and of course our Mind Ambassador Clarke Carlisle launched the Mental Health Charter for Sport and Recreation. And initially we thought that was going to be quite a small project. We anticipated around 10 signatories. In the first month we had 100, and now we have almost 500 signatories. So we've been on a real journey. The peak of the pandemic may have passed, but we're now experiencing a mental health emergency. COVID-19 will have a deep and lasting impact on the nation through loss of life, the impact of multiple lockdowns, loneliness, and the inevitable financial impact. And our coronavirus research, on the first slide that we have, published in July, showed that for people already experiencing mental health problems, 2/3 of adults and more than 2/3 of young people say their mental health has become worse since the first national lockdown. 1 in 4 adults and over 1 in 6 young people experience mental distress for the first time during the pandemic. And our own research suggests that half of adults and over half of young people have coped by exercising during the pandemic. The pandemic, though, has also highlighted an important issue that one of our experts by experience fed back to us during lockdown. There can be too much of a good thing. So while for many, physical activity can be a vital tool in the prevention and management of good mental health, for some it can lead to over-exercising and exercise addiction, and this has been heightened during the pandemic. We were proud to work alongside Sport England and others to advocate for physical activity to be one of the reasons people could leave their homes during lockdown as a way to support their physical and mental health. But for some people, this exacerbated their already tricky relationship with physical activity, with some people telling us they were exercising for up to 10 hours a day. It's hard to have imagined the journey that Mind and the sport and physical activity sector would have gone on if we transport ourselves back to 2014. Early next year, we will publish our Performance Matters in Elite Sport, 7 years on from the initial report that launched us on this journey. Early insights from this reinforce the need to look after the people looking after the people, the importance of managing transitions and the impact of social media. Clarke Carlisle, who'll be joining us today, fearlessly shared his story with us some years ago and paved the way for others to speak openly about their mental health struggles. This summer, we've seen global athletes speak openly about the impact of sport and the pandemic on their own mental health, with Simone Biles, Adam Peaty and Ben Stokes taking a break to protect their mental health, and Naomi Osaka requesting what we'd describe as reasonable adjustments to support her mental health. So when Sport England approached us in 2014 as a national mental health charity with local reach through our federated network, we worked with people with lived experience of mental health problems to co-design interventions to support people to access physical activity. This was the Get Set to Go programme. Through Sport England and National Lottery support, we have reached almost 10,000 people across the 2 phases of our Get Set to Go programme. The programme has supported people to be active in their local communities through peer support, where people with their own experiences support others. And in 2018, we were able to extend our Phase 2 programme from 10 sites funded through Sport England with funds raised through our On Your Side partnership with the EFL. So 65% of participants increased their activity levels during Get Set to Go. 61% of participants' quality of life scores increased. 348 volunteers harnessed their insight and lived experience of mental health problems to support the delivery of the programme. And while Get Set to Go is a successful standalone programme, it is also much more than that. It provides a blueprint and evidence base that has been shared with our colleagues across the sector and across the mental health sector, such as mental health commissioners, local minds, other charities, even internationally, through to local authorities, sports clubs and governing bodies. From early on in our work in the sport and physical activity sector, it was clear organisations had a genuine interest in improving the culture around mental health and to foster greater understanding and confidence. The sheer number of signatories to the Mental Health Charter is heartening, as are the number of people accessing today's event. And the fact that over 40,000 people have accessed our mental health awareness for sport and physical activity e-learning, which we developed in partnership with UK Coaching and Sport England. That training supports people so they can better spot the signs and signpost people to professional mental health support. And we're pleased that it will be made available to a further 25,000 volunteer coaches through the Retrain to Retain scheme, which launched last week. The sport and physical activity sector plays a unique role in society. As Nelson Mandela famously said, sport has the power to change the world, the power to unite people in a way that little else does. It has certainly done this with mental health. From our own research, we know that 1 in 4 people said hearing a celebrity, like a sports person, talk openly about their mental health inspired them to get the support they needed for themselves. The phenomenal support we've seen over the past few days with World Mental Health Day on Sunday, including many of you taking action, shows we are at a tipping point for talking about mental health in sport. And now we need you to turn that into action. You, our partners and our future partners, have shifted the culture. You have taken the message that we all have mental health to your staff, your athletes, your participants and your supporters. By working together to place the Mind logo on the helmets of McLaren F1 drivers Lando Norris and Daniel Ricciardo and supporting us to raise funds. ASIC's taken over a whole town to improve mental health, as we'll hear about later, and funding our research into elite mental health and Get Active running groups across England and Wales. And then there's Merrill, who have supported our Mind hike and distributed over 2,600 walking shoes to Mind beneficiaries during the pandemic. Sport England and the National Lottery, who have invested in us to systematically support the sector and change the lives of millions through physical activity. And then we come to football, our national sport. Well, it's been a year of highs and lows on the pitch. Gareth Southgate certainly picked up the mood of the nation at a time when we needed it. Hayley's given me permission to mention Leeds United promotion. I said I didn't need to, but obviously I can't help myself. It's fair to say football has helped to lead the way. We've been a proud partner of the English Football League since the 18-19 season, and you'll hear later from the EFL CEO Trevor Birch about why they partnered with us and how, by taking a historic decision to place the Mind logo on the back of the shirts, it is reaching 18 million people and led to changes in clubs and community organisations across the country. Heads Up with the Duke of Cambridge provided new landmark moments, such as starting the FA Cup third round a minute late to take a moment for mental health, and also the introduction of the Mentally Healthy Football Declaration. And we're also grateful to clubs such as Leyton Orient. They've put Mind front and centre with support of the Harry Kane sponsorship deal. And most recently, fierce London rivals set aside their differences to fight for the nation's mental health this summer with the Mind series, where we saw Arsenal, Chelsea and Spurs raising not only £230,000 to support our fight for mental health, but engaging young people and local minds in their communities. I could share more, but I am sure you want to hear from your colleagues in sport. The pandemic will leave a deep and long-lasting impact on the nation's mental health. It's entrenched existing inequalities, and this is something that we will be prioritising at Mind through our new strategy, with a focus on supporting young people aged 11 plus who have experienced trauma, fighting for the mental health of people living in poverty and for racialised communities. This will require us to work differently and partner with organisations that can meet the needs of these communities. But today is overall a celebration. It provides time for reflection, sharing knowledge and learning from you, our partners. While we have come a long way, there is still more to be done to truly embed mental health across the sport and physical activity sector. We've been relentless in our campaigning for mental health to be embedded in training and coaching qualifications, so it becomes established as first aid or safeguarding. In your organisation, with a mental health lead, along with policies and programmes providing mentally healthy workplaces for staff to work and thrive, or as part of a toolkit to support people experiencing mental health problems, ensuring that we can reach out and work collaboratively with our colleagues in health and mental health to provide more holistic, person-centred support. And we can't forget the need to involve people with lived experience of mental health problems in the design, development and delivery of all of our activities and programmes. So today you will hear lots of offers of support from Mind through our physical activity team and our resources. But in return, our primary ask of you today is to make a pledge, to turn your intention into action. It may be small or big, it may be something you can work on directly, or it may require you to speak to your senior management team for support. This afternoon, during our team talk discussion groups, we'll be asking you to make a pledge and share it with us so that we can be with you every step of the way. Our second ask, which is one that I'm sure you are already aware of, is to join the conversation online at #SportsMinds. Let's share the learning and knowledge and celebrate our successes. So welcome, congratulations for all you've achieved so far, and thank you for all you've done and for being here today to continue on that journey. So that's enough from me, and now it's my pleasure to invite Mike Diaper to the stage. Mike is the Executive Director of Children and Young People Tackling Inactivity at Sport England, and Mike commissioned Mind to deliver Get Set to Go back in 2014 and has been with us on the journey ever since. And our work simply would not be possible without the ongoing investment from Sport England. So a huge thank you, Mike, for having the foresight back in 2014 and partnering with us long term. But over to you. Thank you.
Thank you, Karen, for those really kind and generous words. Good morning, everyone. It's great to see so many of you face to face. This is only my second face-to-face event. First time on a tube today. That felt a bit nerve-wracking. I remembered to put a suit on, which was all good. Welcome to all of those joining us through the video stream. I'm absolutely delighted to be with you today. From the outset, I really want to underline the importance of the partnership we've forged with Mind. It's such an essential part of what we are doing. I know many of you actively support that partnership in one way or another, so thank you so much for what you are doing too. As Karen said, the last 18 months have been really hard for us all. The disruption to every bit of our lives, our work, has been massive, and the impact on all of our mental resilience, unprecedented, and I don't think we probably fully yet know the extent of that impact. One of the good things during the two big lockdowns was that we were allowed out for exercise. As Karen said, that didn't just happen by chance. We had to advocate for it, but actually we were knocking on an open door. Getting out to walk, run, cycle was such an important thing for people. I live on my own small flat, no balcony or outside space, so getting out literally was one of the things which kept me sane. And I know that's for being the same for many other people. And in fact, we weren't just allowed out, we were actually told it was the right thing to do by the Prime Minister, by the Chief Medical Officer. And that really resonated, and people did respond. And yes, as Karen said, some people went a little bit further. 10 hours of exercise a day feels quite I can't even imagine, actually. But that gives us a massive opportunity to build on. Exercising is just something you normally do and you should do and is a good thing to do, has never had such a high profile. So in the time I've got this morning, I wanted to just do two things. Start by just saying a little bit about our Uniting the Movement strategy, and I hope that you will find a common purpose in that. And then reflect for a moment or two, if I can, on our partnership with Mind and look to the future of that. So, Uniting the Movement sets a 10-year vision to transform the lives and communities of our country through sport and physical activity. It's a strategy built on the belief that when we move, we are stronger. Stronger as individuals, stronger as a nation. It's also built on the belief that let's build activity, movement, sport into people's lives in a way which is right for them and on their terms. We're not trying to turn everybody into a superstar or an Olympian or a Paralympian. This is about finding the right activity for you. I trust that we all know and care that when we move, we get great benefits to our health, our communities and the economy. So the strategy sets the focus of our time, our investment across the next decade, and is built around three objectives. First, it's about advocating for movement, sport and physical activity, the importance of moving and getting active in whatever way makes sense for you. And that's all being done through the lens of tackling inequalities. Again, great synergy between what our two organisations do. Some people just don't have the same opportunity to move, find it harder, and we need to remove those barriers. Second, the strategy is about joining forces around 5 big issues: recover and reinvent from the pandemic, connecting communities, positive experiences for children and young people, connecting to health and well-being, and I'll say a little bit more about that in a moment, and active environments. The strategy was built on 18 months of consultation. Many of you in this room and watching online were part of that consultation. Those 5 big issues were the biggest kind of must tackles. These are the things, if we tackle nothing else in the next decade, and they're not easy things to tackle, but they are the things which would make the biggest difference. And then third, it's creating the right catalysts for change to make progress, and that's about effective investment models, people and leadership, innovation and digital and data and insight, and good governance. And it is very much about us changing as an organisation too. We published in April a 1-year transition implementation plan focused very much on the recovery and the transition out of lockdown and COVID, and also the things we need to do at Sport England to get ourselves fit for purpose for the next decade. Towards the end of this year, probably in December, we'll publish the first 3-year implementation plan, which will set out much more detail of how we're going to deliver against those big issues. And we're still talking to people and building that, and I hope you can be part of that conversation. I want to come back to one of the big issues, if I may, namely effectively connecting sport and physical activity and the system that delivers that better and more mainstreamed into health and well-being. I think that goes to the heart of today's conference and the partnerships and the work we've been doing together. All of us here today know that our physical and mental health are our biggest assets, and that being active unlocks so much good in terms of our well-being. It can also unlock some other things which we need to address, of course. But we also know that nothing like everyone is able to enjoy the benefits from being active. And in fact, the very people who would get the most from being active often miss out through no fault of their own. And we need, as I said a moment ago, to remove those barriers. Knowing how sport and activity can help us both prevent and manage a wide range of health conditions, we therefore have a responsibility to help others understand and value the role sport can play. There is absolute growing interest. I remember back in 2014 when we began the partnership with Mind, bringing the worlds of mental health and sport together felt really a little odd, actually. But now there really is interest in the power of sport and physical activity to drive the health of our nation. And I really hope that we can capitalise on that. I actually trust that you'll work with us and Mind in the coming decade to continue the work. I said I wanted to just reflect at the end on the partnership. It's one of our longest and most endearing partnerships, built since 2014, 7 years ago. Feels a lifetime ago, actually. It came about, I should actually say, it was one I have to go to, and I'm going to be a little bit naughty. I have to go to a lot of ministerial roundtables, and sometimes great things come out of them, and sometimes not that much comes out of them. Actually, what came out of a ministerial roundtable back in 2014 was we actually began to talk to Mind. And actually, it was a really simple conversation between myself and Paul, actually. Look, we've got so much in common. We need to work together. And I was expecting him to kind of push me away. But he actually said, no, let's set up a meeting and let's start working. And that was the impetus for the strategy. What the partnership does is bring the worlds of sport and physical activity together with mental health. It builds on one of the most trusted voices for those dealing with mental health issues. It combines effort, and that, quite simply, is why we wanted to partner with Mind and why we want to continue working with them. I'm so proud of the things which we have done together, all of them co-created by people who have lived experience of mental health. That's that desire to co-create with the audiences we need to reach is now one of the fundamental principles of uniting the movement. That's one of the kind of unintended positives which has come out of the partnership. So, Karen, you mentioned some of these, so I won't labour them. Get Set to Go was the first thing we did together, and as you heard, something like 10,000 people benefited. What it also did was build the evidence base for what sport and physical activity could do, the difference it could make. And then more recently, the mental health awareness for sport and physical activity e-learning has reached even wider and will go on to reach even wider audiences with great help from UK Coaching and First for Sport. Something we've really valued, and I think the sector has valued, has been the strategic support Mind has been able to offer to the likes of SIMSPA, UK Active, Activity Alliance, the work you've done with England Athletics around the Run and Talk initiative, and also the 9 regional networks which have been established. All of that has been brilliant, and I can't stop without mentioning we are undefeatable. Mind have been in on that campaign right from the start. An award-winning campaign, again, built by people with lived experience, which, as its heart, just says, find something which makes sense for you. And, you know, on the days where you can't get out of bed, and there are always days like that for all of us, it's fine. Stay there and do something the next day. So, looking to the future, I hope you've heard that mental health remains a key priority for Sport England within our new strategy. We really want to build on the partnership with Mind. That's why, together with national governing bodies, active partnerships and a number of other organisations, they've been invited to apply for key partner funding, long-term 5-year funding. That process has got to see itself out, so I'm not allowed. I'm not announcing that 5-year funding. I wish I could, but I think we should be quietly confident. The partnership has achieved so much. It's been excellent, and I'm really looking forward to the next 5 years, the next decade. I was asked to kind of end with a bit of a thought provoker. So my thought starter or question is, what's the one thing we could now do together which could really change the dial coming out of COVID? Thank you so much. Thank you to Mind, and thank you to all of you for the great work you're doing. It's really appreciated. I'm delighted to be with you today. Thank you.
Thank you, Mike. It's really exciting to hear about uniting the movement, and I'm sure together that we look forward to all sector partners working with you to address some of the challenges you laid down. Sadly, due to diary clashes, our next guest, the Minister for Sport and Tourism, Nigel Huddleston, is unable to join us in person today. But he has sent us a short video address, which I'll now just ask the tech guys over there to play for you.
I'm delighted to welcome everyone to today's event on mental health in sport and physical activity. Thanks very much to Mind for inviting me to say a few words to you all, and I'm very sorry I couldn't attend in person. One of my top priorities as Sports Minister is to get more people playing sport and enjoying the benefits of being active. Improved mental well-being is a key focus within that. Mind have a long history of providing excellent advice, support and resources to anyone experiencing poor mental health, regardless of their background. Their impact is profound. Mind has transformed the lives of countless people across the country and continues to strive to make sure those who are struggling are treated with respect and get the help that they need. Since 2014, our arm's length body, Sport England, have partnered with Mind to fund and deliver the Get Set to Go programme, amongst other initiatives. Since then, they've supported over 8,000 people to improve their mental health through engaging in physical activity. Of course, this last year has been very difficult for society and the sports sector too. over the course of the pandemic, we have prioritised sport and physical activity. Even during lockdown, we made sure that people could still exercise outdoors. And that was because we know the huge role physical activity has on the nation's physical and mental well-being. As we emerge from the pandemic, I don't think the importance of mental well-being has ever had such a high profile. And this is particularly true in sport, where Naomi Osaka, Ben Stokes and Simone Biles have made brave and significant stands over the summer about the importance of mental well-being. This only strengthens my resolve, as I'm sure it does for all of you, to redouble our efforts and ensure we keep the focus on reducing the inequality that people with mental health conditions face when accessing sport and physical activity. Awareness, education, and understanding of the needs of those with mental health conditions are key to changing attitudes and increasing participation at all levels. Now more than ever, working together is essential to ensure that people are able to enjoy being active and reap its benefits, both mentally and physically. On that note, I hope today's event goes well. There are plenty of opportunities for the sector to collaborate to drive forward this important work, so I wish you a productive day.
Big thanks to the Minister there for taking time out to send us that film, and I guess on behalf of all of us, a big thanks for the Minister for prioritising us being able to be active outdoors during the lockdowns at a time when for so many nations that wasn't a possibility. So moving on to the next speaker, we've been working with our next speaker since this work started in 2015. Dr. Florence Kinnafick at Loughborough University has led on the evaluation of both Phase 1 and 2 of our Sport England partnership. Flo has also been working with Professor Andy Smith from Edgehill University to develop a policy briefing paper on behalf of the Sport for Development Coalition and Mind. And this paper looks at how movement, physical activity and sport for development can support the response to the current mental health emergency. So welcome to the stage, Flo, who will tell us more.
Hi, good morning everyone. It's a real pleasure to be here and I think, as our speakers have said so far, to be in person. This is my first in-person conference, so I'm really excited to be here and absolutely delighted to talk about the work that I've been doing with Mind. So today I'm going to give you a bit of an overview. Is that working? Yeah, there we go. A bit of an overview of the programme, the sector support programme that we evaluated, talk about our evaluation, what we did, what we found, give you the recommendations that we made as well, both to the partner organisations and also to Mind, and then finish with some thought provokers or conversation starters and thinking about the pledges that Karen has asked you to make as well to take from this. So before I go into the evaluation itself, I wanted to give you a bit of an overview of the sector support programme and what it was that we were evaluating. So the aim of the programme was to increase the number of sport and physical activity providers that were equipped with the skills to support and engage people with mental health problems in sport and physical activity. And there was 4 offers as part of that programme with a varying amount of reach throughout the sector and also of varying levels of support from Mind. So the first one, the universal offer, included training, toolkits and various resources as well, and that had the greatest reach across the sector. It was available to everybody. The second offering was the regional networks that were co-produced with the aim of bringing together organisations to network and share best practice. Also, Mind worked with operational partners on specific programmes, for example, the Mental Health Champions scheme. And then Mind also worked with strategic partners on a strategic level, influencing key programmes, policies, and then cascading all that learning down to the sector. So COVID, as you can imagine, impacted the programme throughout, and I've just included this quote from our academic report mostly to acknowledge the incredible efforts that Mind went to during that time. One, to evolve the programme to within the constraints of what was possible of COVID-19, but also dealing with the huge amount of support that was needed. I think there was 61% increased traffic to the physical activity pages on Mind, so huge amount of support needed, and the efforts that Mind went to accommodate that. So the aims of our evaluation was to understand the effectiveness of this support, sector support programme. And we did so through 4 objectives that you can see here, and that's how I'll present the findings today. So we wanted to know the effectiveness of Mind in engaging with those sector partners and organisations, understand the effectiveness of supporting national strategic partners in implementing their action plans, the effectiveness and sustainability of Mind's engagement with those partner organisations, and also how can Mind most effectively facilitate that knowledge exchange throughout the sector at a national, regional and local level. So we employed an evaluation framework, REAIM, and answered these questions for each of those objectives. So specifically, we looked at reach, effectiveness, adoption, so the use of the knowledge that was gained, implementation, so all the hows and the whys, the organisations implementing that knowledge within the workplace and also the wider sector, and the maintenance, so thinking about the sustainability of these relationships, sustainability of knowledge exchange and those mental health initiatives. So to give you a bit of an overview of what we did in terms of the data we collected and the methods that we used. So we had focus groups with Mind, the physical activity team themselves, experts by experience, and the operational and strategic partners. So initially trying to find out, okay, what were the expectations of this programme? What were the anticipated barriers, challenges, facilitators for implementing the programme? And what were the anticipated outcomes? And also, what did effectiveness look like, and what was that perception? And then in the latter part of the programme, we spoke to these individuals again to try and understand, okay, what were the experiences over the last 2.5 years? What went well, what didn't go well, and look into the future, what still needs to happen. We also engaged with the regional networks through telephone interviews, so the leads and also their partner organisations in a similar manner, so at the beginning to try and understand where they were at the beginning, what was the anticipation of the regional networks, and then at the latter stages to see how things had progressed. Also, we employed an interview series with 8 employees from one specific strategic partner. We wanted to have a kind of a case study approach here to try really understand within an organisation how do people experience those changes over a number of years when initiatives, action plans are implemented. Also, we sent out a qualitative survey for those people who had attended some of the webinar series. So overall, we had 58 hours of data, which took a while to get through. We involved 28 organisations as part of that evaluation, and we spoke to 55 individuals, plus had 108 people respond to our survey. So for each objective, so moving on to the findings now, what I wanted to do was give kind of one overarching focus of the conversations with regards to the findings that encapsulated what was coming out for each of these objectives. And for the first objective, it was all about meaningful communication. So the partners and the sector organisations were unanimously positive about the relationship with Mind. And this was strengthened through meaningful conversations, understanding about the need to be flexible, understanding about the work climate, particularly through COVID when there was so much impact, being open for feedback, and that two-way conversation was really important. Credibility as well for Mind, being having that credibility within the mental health space. This increased reach, recruitment, engagement of the partner organisations, but also the partners that they were working with themselves. So I've got a quote here. I'm excited. We're partnering with a big hitter, which gives real credibility to our work and what we're doing. They know we have expertise in the sports sector, but by us partnering, it gives us greater credibility, which means we can have greater influence and greater reach. We're stronger together. Another facilitator to sector engagement was the importance of the buy-in from senior managers, and how, with the buy-in, that was where work could progress. Some barriers to engagement included the dedication of time and resources to prioritise mental health work. And I think during COVID that was an increased problem with increased workload, people learning to work differently. And also, so this quote here I've got, if you want to do something, you want to do it well, it needs to be part of somebody's job as opposed to an add-on. So some dedicated time and resource is fundamental. Also, a barrier was making contact. If there was a single point of contact within an organisation, sometimes that could challenge the progression of the work, particularly if that person left the organisation or was particularly busy, if they were volunteering to take this as an add-on for their job role. So that could hinder the progression of the work as well. I think there was certainly an increased appetite for mental health support work, and as the programme progressed, as COVID became, and the pandemic became a part of it, there was an increased appetite. And this was perceived as a bit of a double-edged sword. So it highlighted how COVID had exacerbated those mental health problems, and actually there was a real big, greater need for mental health support. But also it highlighted that people knew where to go to get that support. It meant that the visibility was there and people could go to Mind. But this was a bit of a concern because that huge requirement for support in terms of the capacity of doing that. So it was a bit of a concern from Mind themselves and also some partner organisations. So with the second objective, then this largely focused around taking action. Okay, so moving that understanding and moving it into action. Organisations had successfully implemented part or all of their action plans, and some of the examples that we were told about were wellbeing committees with terms of references, birthdays off that weren't included as annual leave, increased signposting to wellbeing and mental health services, online activities during lockdown and home working to really create that connectivity within the workforce, and wellbeing items being on top of the agenda. And employees considered the mental health narrative, and this was in formal practices. So, for example, the agendaed items at the top of agendas within meetings, and also the wellbeing committees. But those informal practices made a real difference as well. Just checking in on colleagues and asking how they were doing. That was making a difference within the workplace. And there was a real willingness to drive change and a real willingness to take ownership over that drive of change. So I think a lot of people in this quote here from a strategic partner employee, a lot of people are happy to be in meetings with great subject headings and really robust agenda, but actually getting to the end of that meeting and assigning roles, tasks, task forces, projects to people is what's important. Even though we're weighed down, I think just willingness to engage where you're able to receive something at the end of it, like a project, and say, I'm going to run with it because I see the benefit of it and I can see the support. I can see that I can support it. There's a couple of different things that I've sat in on, a task force I've been part of, that just don't move fast enough. So there was that real willingness and wanting to drive change throughout the organisations. But there was a sense that still there was a lot to be done, and there was a lot to do still to move that forward, and particularly around stigma and self-stigma. It's also the high performance culture within sport. Although it was perceived to be changing, it was still apparent in some instances, and that was considered a bit of a potential barrier to implementing support, but also to take up support and approaching people for support. There was also some misalignment between senior management narratives around mental health support, and although that was definitely perceived as genuine and appreciated, some of the role modelling of work behaviours and that always-on culture certainly kind of caused that misalignment. And then COVID-19 had accelerated the integration of the mental health awareness, and here I've got a quote from an expert by experience saying, I think that COVID has done, it's got a lot of people thinking outside of the box. That's where beautiful things came out of the lunch and learn sessions, creating videos of how to do exercise in your living room, the toolkits. I think without COVID, I don't know if certain things would happen. So I think COVID helped gain momentum, accelerated some of that integration of mental health awareness. But it did also sometimes slow down the implementation of action plans or change direction of what was initially intended. So for the third objective, this was all around networking and bringing people together to share best practice. So there was a notable improvement in mental health awareness across the sector, and particularly initiating conversations around parity of esteem and collaborative working between multi-sector partners, so health and sports sectors. So here, this quote, "We're starting to see an emerging role for connecting health professionals who help people with mental illness with physical activity interventions." So there's an understanding of this awareness, but then that wanting to understand what we could do further. So how do we ensure that medical professionals are able to prescribe physical activity to other people, this package of support, and not just straight towards pharmaceuticals? We're not there yet, but we're seeing activities being pushed because they're good for our mental health. We're seeing a much stronger role for prescribing activity. So the regional network was crucial for promoting conversations around that system-level approach for mental health. And there was an importance to try, or however, I guess there was an importance to try and better identify and work towards some mutual priorities, and sometimes kind of conflicting agendas hindered that. And again, COVID-19 impacted plans across the board, as with all of these objectives. Lockdown did facilitate the increased use of online resources, and that did help the reach, certainly with the universal offer and all the online resources that were available. But I think it's really important to still remember that we have pockets in society or people who live in digital poverty, and those individuals may not have access to that information. So although there is greater reach, it doesn't always reach everybody. So for the fourth objective, overall partners did perceive a positive impact on attitudes, knowledge and awareness through this knowledge exchange. And specifically and importantly, there was an improvement in the understanding and the importance of tailored messaging within those resources that were being shared. The implementation of collaborative working strategies was seen as a real positive outcome of the programme. So here, this quote from a regional network partner, "Making sure that people in the group were all relevant. It's about reaching all of those corners and having an outcome, a real clear collective plan of what it would achieve. It was about a connecting network. I found this valuable. You get to talk to someone and then you're like, oh, we're trying this. And then you've got each other and you can go from there." And that collaborative working was a real positive move forward. So an increased visibility of the sector support programme through the universal offer and the sharing of knowledge included kind of monthly newsletters, the social media, virtual conferences and CPD opportunities. The regional network was successful in promoting collaborative learning to deliver mental health initiatives both regionally and locally. However, there was still a need to focus that targeted local delivery for long-term maintenance of relationships, and particularly the importance and the role of local minds in that local delivery, and that they were a key part of progressing that work. Okay, so from the findings, I wanted to finish on this quote. It's rather long, but I thought it illustrated quite nicely how, for this particular individual within the strategic partner, one of the employees, felt that there had been change over time, and how from previous mental health work that they'd done, this felt different. So we've always had things in place, but what's happened is they're now connected. The connections are thickening to such a point that they're merged in each other. So often you have support and care for your colleagues in a bottom-up approach, and that gets so far, and it's just not accepted by the organisation because it interferes with business and performance. Then you've got the top-down approach, which is that bit that can often be seen as, do they really mean it? Is it a tick box? What award are we trying to win? But what we've got now is that bottom up has gone all the way into the senior stuff, and the structural stuff has come all the way down to staff. So we've got this ingrained process where staff can talk about their situation. It's no different to having an injury. It's just accepted that somebody is having some time out and there's no pressure on them. It's all encompassing now. And you can see there's kind of that awareness does feel like it's moving on. So the learning from the evaluation culminated in some recommendations that we provided to Mind, and this was for partner organisations and also for Mind, the physical activity team. So for the partner organisations, importantly, we recommended that they should involve experts by experience, those with lived experience of mental health problems in all aspects of programmes. So the design, the delivery, the development, and the implementation of these programmes. And mental health should really be embedded across all work activities through action plans, mental health strategies, and policies within the workplace. There should be a focus on employee mental health side, alongside supporting and delivering mental health initiatives externally. So that was being done really well, externally facing programs, but internally still looking after your employees as well, so having that focus. An individual, and preferably individuals, within a workplace to act as a contact point within the organisation, and consider having the mental health support work as part of job roles and job descriptions to make sure that there is capacity to actually conduct the work. Increasing collaboration and knowledge exchange between sport and health organisations is very important, and making the most of those regional networks which can introduce organisations to each other and encourage that collaborative working. And then increase the promotion of success stories and celebrate those success stories and bring those success stories to life and share those good examples of good practice with the partnering organisations. So our recommendations for Mind, and I've put them together into 4 points here. So we can see that we did see evidence that there was change. There was an increase in mental health awareness. There was an increase in the willingness to want to change. But there's more to be done. So continuing that work with organisations to ensure that they can provide the mental health support for their employees and partners. An example of doing this is the directing organisations to get financial support to be able to allocate that all-important time and resources to the work. And also helping the organisations to have the autonomy over those that mental health work. Also, updating resources, so working with partners to do that effectively, promoting upcoming webinars, CPD and networking events. Also to continue to work with strategic partners to create quality assurances and competence measures of mental health knowledge in the sector, and to really embed that mental health support work within the sector. Understand the barriers and the challenges of that knowledge exchange and how we can best spread that knowledge throughout the sector and what stops that happening. So sharing this information with partners is all important. And then encouraging that multi-sector collaboration, facilitating the engagements, using the regional networks to be able to do that. And where possible, kind of delivering events like this is a perfect example of how we can bring everyone together to network, training workshops where those representatives can come together. So that's what I wanted to cover in terms of the evaluation. Now I've just got a couple of slides left. Karen mentioned this work that I'm part of, that Andy Smith, Professor Andy Smith, here in the front row, is leading. So we're working with Hayley at Mind and Ollie Dudfield, who you'll hear from this afternoon from the Sport for Development Coalition. And we were asked to write a policy brief and provide some evidence-based recommendations on the role of physical activity sport and sport for development for promoting movement and mental health since the pandemic, where the pandemic has highlighted and exacerbated those mental health problems and those inequalities. So the aim of this paper was to inform government policy approaches to mental health and community-based physical activity sport and sport for development, and support the work of public bodies, funders, commissioners, policymakers and providers of community-based programmes which seek to promote movement and mental health. So this paper is written, and we're working with key stakeholders to refine that content. So watch this space. So my thought provokers to leave you with, which goes along the lines of what Mike was saying. Actually, we have seen evidence that there is change happening. Things are moving forwards. There is some momentum that we can build on, that we need to keep going. So what I ask of you today to think, okay, what can you personally do to embed mental health support in your work? Those formal or informal practices that does work, that does make a difference to colleagues. But what do you need for that to be able to happen? Also within your organisation, how can you better support mental health? So thinking personally, but also within the organisation. And again, what do you need to happen to enable that support? And then thinking back to that last slide, okay, what commitments need to be made by you, your organisations, to respond to the mental health crisis that's been exacerbated through COVID-19 in the pandemic over the last 18 months? So thanks very much for listening. I know there was an awful lot of information for you today, and I hope to speak to you throughout this afternoon.
Thank you, Flo, for sharing the recommendations. Great work by you and the team. And I'm sure they'll resonate to many of us here and help set the context for the discussions today. Hopefully you didn't notice that action taken on there seamlessly, I thought. I was trying to distract you. It's now time for me to hand over the mic to a sports broadcaster who will reflect with our experts by experience on the journey that we've been on and how we can now, as a sector, scale this and take it further. Gary Bloom, I am sure, needs no introduction to the sports buffs in the room. Founder of Sports Psychotherapy, the first sports performance psychotherapist, as well as a TalkSport host. I'm now going to hand over to Gary, Clarke Carlisle and Andrea Corbett for the next session.
Hello everyone. What a privilege to be here in person. I've just been across to the trophies there and had a little look at the league playoff final trophy, because as I'll explain shortly, I'm the only, as far as I know, the only sports psychotherapist embedded inside a football club with Oxford United, and we came very close to that trophy for the last 2 seasons. So there's a sort of pain and pleasure there, thinking I'd like to get my hands on that in the next 9 months, but that's another story. I'll be introducing my panel shortly. I'm going to say a little bit about my work as the only psychotherapist embedded in a football club, which to me is a bit of a tragedy, if I'm honest, because of all the excellent work we've already been hearing about today. And I take my hat off to Mind and their coalition with the EFL. It seems inconceivable that of 92 football clubs, there is not a psychotherapist amongst them, and hopefully I'll try to explain why. I'm afraid to say, still to this day, in 2021, there is a massive prejudice against looking... Oh, is this not working properly? Thank you very much. So there's still a massive... In 2021, there's still a massive prejudice against looking at issues like anxiety, depression, addictive behaviours, transitioning, leaving the game, and the psychological impact of injury in our sports clubs. And my work was described very, very, I think, cleverly by one of my supervisors, who's a sports psychologist, of working below the line, below the surface. Things that are not evident inside our sports clubs and organisations, things like anxiety, depression. We can't see them. People are not coming into our sports organisations and saying, you know what, I don't know what I'm doing. You know what, I'm not good enough. I go home and worry about this. Psychologists have traditionally, although this is changing, have worked above the surface. Issues like strength and conditioning statistics, injuries, things that people can see. But nobody has yet really worked beneath the surface. I've written a book about my experiences as working as a sports psychotherapist called Keeping Your Head in the Game, where I take 10 fictitious people through sports psychotherapy and the changes that are possible throughout my work with them about impacting on their performance and how they feel about themselves, because my buzz phrase is quite simple. Happier players play better, but happier bus conductors work on buses better, happier builders build better. All of us have that potential. And the gap between psychological work in sports and player well-being is beginning to narrow. And if I want to try and achieve anything in my presence here today is to create that gap, to make it smaller and smaller. And I'm beginning to write online courses where hopefully I can encourage people from the sports psychology world to think about player well-being and mental health. That's me. That's my free plug for myself, but I only get 5 minutes. Thank you very much. So I'd now like to introduce my panel members, and I've got great delight in somebody who used to play for my football club, Leeds United, Clarke Carlisle, former PFA chairman, professional footballer and line ambassador. So would you welcome, please, Clarke? And Andrea Corbett, coach, personal trainer and advisory group member. And I'm going to start with you, Andrea. And you asked me to do this, so we will let everybody into a little secret. Tell me a fun fact about yourself.
Is this on? Hello? So it's not really a fun fact because it's actually on the board, but I am a British champion and international professional bodybuilder. And that all came about because of my lived experience of being diagnosed with a mental health illness in 2015 and being advised to take up physical activity. At the time, I was confused, like, why is the doctor telling me to go to the gym? There isn't anything physically wrong with me. I'm coming here to say that there's something mentally wrong with me. And I didn't actually understand the connection between the two. I obviously took it a few steps further, but my few steps was because I was always used to setting goals and doing things for myself. At the time, I still am a qualified school teacher, but I resigned because of my diagnosis. So I was setting goals for myself, and so my goal was to compete. It wasn't to become a bodybuilder, it was just to compete, so that would give me a reason to get up every morning, have a shower, and so on and so forth. And my main reason was to get well again, to get back to being the mother to my son that I had stopped, well, not stopped, but had been, had trouble doing whilst being sick. So long story short, I entered my first competition, which was a national competition. I won that competition, and that was in 2015, and from since then, it's just been ongoing, and in 2018, I won the British Championships and was awarded my pro card. Sure, what's wrong with the mic here? Was awarded my pro card, and that's where my fun fact comes into it.
Many thanks. Wow. Talk about expert by experience. So I'm going to turn to you, sir. So I've been asked to ask you about your reflections, Clarke, on the journey the sport and physical activity sector has been on since you helped launch the Mental Health Charter for Sport and Recreation back in 2015.
Thank you, Gary. I've got a fun fact too,
Go on, I beg your pardon. A fun fact first with you,
I've got a countdown teapot.
Yay! Go on, you have to explain that now.
It's been a fantastic journey over these past 5 years, and it's what's really struck me is that Mind, one of the the very first flag bearers on the topic of mental health in this country. They predicated a lot of their initiatives on it's good to talk, getting people to start to verbalise and open up about their mental health and what they're living with. Since the inception of the Mental Health Charter, what I have seen and what I think needs to be progressed further is that as a nation, never mind as sporting bodies, our appetite to talk and to address mental health has grown exponentially. Now, what we need to marry with that is the confidence and the competence in knowing who to talk to, when to talk to them, and what to say. And that means upskilling the entirety of society to different levels. And we, as a sector, need to be able to start setting the parameters around those levels, because one of the inherent troubles with mental health and either being an advocate or being a supporter or being a person in a position of influence or responsibility is the ambiguity around the boundaries of self and services. So if we can upscale and upskill our people, our societies, our communities to know that it's our job to support the next person, but it's not our job to fix them. We need to be knowledgeable enough to know that A, B, and C may be going on, and this is where we pass you on to the professional services. And I'm finding that being reflected across the entirety of the sports sector. Some great things going on, Gary. Like you said, Oxford and with Godric there. I'm working with Godric Smith, one of your directors, a real advocate for implementing these systems within sports clubs. We're seeing some fantastic initiatives and programs in certain sports or in certain clubs. And what we need to do is collate and conflate all of those initiatives so that we can share best practice, so that we can raise our requisite level of knowledge around what it is that people and athletes need, and so that we can have a uniform system of support that is uniformly accessed by everyone.
What a great answer. I'm going to give you a for instance, and I hope what I'm going to say isn't too shocking, but I think it's worth sharing with you, because this is an expert by experience panel. So all of that is true, all of that exists, but you go into a football club, and this is my experience working with an EFL club, and a young man says, "Can I come and see you?" And I say, "Yes, of course, come to my client room." And he is wearing a pink bib with the words written on in biro, "I am rude word," and wearing pink socks. And I said, "Why are you wearing that?" And he said, "I'm the worst trainer of the week, and therefore I have to wear this bib and these socks as my way of reflecting this." And I told him, no, as a psychotherapist, of course, I could say, "How do you feel about this? What does it remind you of?" I could go back into his whole childhood, but no. I said, "Take that off immediately," and I challenged the club to stop the practice immediately. Why are clubs still in that mindset in 2021?
That's an exceptional question, Gary, and we can talk about individual practices that go from banter to like rituals, rites of passage, etc., etc. But it's all based on that notion of masculinity, machismo, in that team environment, and to undermine that is the core need for us as a society, so that we can break that culture and environment within these places, because it's not just in a male sports team. There's a hegemonic masculinity that manifests itself across all sports teams and across elite working environments. And your position there in the football club, I believe, is of paramount importance, especially as an independent person outside of the coaching and managerial structure. And in order to cement that, players need to be comfortable and confident about your independence and the confidentiality of what they share with you. And just to go back to practices, it's very much in football an industry that continues to do things because that's the way it's always been done. And that is an approach that needs to not only be confronted, but needs to change. We're already seeing that with a generation of young athletes who are empowered in their knowledge of who they are and what they should expect from those organisations and services around them. We see the increase in social activism from, you know, our high-profile athletes across many, many sports, which was totally looked down upon and unheard of, even in my time, you know, never mind in long, far gone times. So, you know, we need to be able to bring all this knowledge together to change what's happening, the culture and environment in a system. And that's only by education. The one thing about football is that football currently answers to itself. That there is no arbiter that sits over, that demands best practice, that demands A, B, and C. And what Mind are doing, trying to advise and cajole football into something, is commendable. But, I mean, at the very core of it, we're talking about the Health and Safety at Work Act 1974. You know, we're talking about creating a culture and environment that doesn't have a risk to a person's mental health. It states in there, personal injury is any disease or any impairment to a person's physical or mental health. It's been there since 1974. So if you don't provide information, instruction, training, supervision, then you're currently non-compliant with the Health and Safety at Work Act. So when it comes to large industries and institutions like football, we've got to take them to task on the aspects that matter to them. And that's compliance. That's them providing the right environment for their employees, and it's, you know, showing that holistic care as is needed in this topic.
Would you believe my nickname in the club when I arrived was the Mind Bender?
I would believe it, yeah. Equally, like I believe that it was a pink bib because of all of the connotations that comes with that archaic notion of masculinity and competitiveness. There are so many different things that need to be confronted in sporting environments, and unfortunately, what we're trying to educate and change within it has many cross-generational divides.
Andrea, do you want to say something about Clarke's comments? Having a mic relay here. Closest we're coming to physical activity.
So thank you for that. When you mentioned about making changes, I myself am not, although I am a bodybuilder, but I work on a grassroots organisation which I have set up as a direct result of my lived experience. So that's called Focus CIC, and what that is about is aiming to support, educate, empower and nurture young people, primarily black and brown young women and girls, about the benefits and importance of physical and mental health. And we've just recently started to, again, when you talk about education, we've started to roll out the gym instructor courses, personal training, and I'm doing a lot now around social prescribing as well, because I feel that that is very important, and that's going to be rolled out for everybody, not just the unique group that we work with, because all young people need to have a space to come to, and with the oversubscription of CAMS, which is a mental health organisation for young people, they need somewhere to go to, and I believe that it's not always medication that we all need, that we can provide that social prescription activities for them. That is really important. So it's happening in like grassroots as well as in football teams, and so just to make that point as well.
Thank you. So a question to both of you. What has changed in the sport and physical activity sector? Consider elite and grassroots level. Are there any initiatives you have particularly been impressed with? Either of you?
For myself, it's been being part of like the Mind Physical Activity Advisory Board. I believe, thank you for being there, and that's hence why I'm here as well. And just being in rooms that I'm able to have a voice and to bring forth what is actually happening at grassroots levels, because a lot of the time we're talking about sports clubs and teams, and that's not always where young people have the natural ability to attend or have the finances to be involved in. So organisations like myself, we provide activities that young people won't necessarily have access to, like wall climbing. I've just done a fencing course, and so really trying to provide these avenues so that they can get into sports teams that are not readily available to them. So that's one thing that I think that has really improved since I haven't been here for that long, but since I have been doing what I have been doing, it's been a great opportunity to be part of all of this.
Clarke?
Yeah, it's wonderful work, Andrea, and it's initiatives like that that are so commendable and need to grow in stature and in number across all of our communities, because one of the difficulties in tackling the support services that are available for our communities is addressing that socio-economic disparity. It's addressing the very different inhibitions and restrictions that might present themselves to our minority communities and communities with protected characteristics. And having a safe space to be able to discuss honestly what those restrictions are, what they look like, without having to justify them in the context of mental health, is going to be one of the key platforms for us establishing services that are fit for purpose and services that will serve our communities. So on a grassroots level, I totally agree with that. I think the education aspect, it goes beyond sport. It needs to underpin our education system. We should be at primary school educating our young men, women and non-binaries about their whole selves. We should be educating about their value and what the care system looks like on a traffic light level, very simply, just like they're learning with their physical health. You know, I have children of varying ages, 22, 13, 11, 3, 18 months. And the elder three, they all knew from 6 years of age what to do if they scald themselves, what to do if they get a nosebleed, you know, what if they fall over in the playground. They know when it's something that they can get through themselves, something they need a teacher for, something they need to call 999 for. When and where are we educating our people, our young people, about their mental and emotional literacy and health on this scale? Just understanding those basic parameters will give a very different look to the services that are overwhelmed. You know, we're talking about CAMHS, which is currently totally unfit for purpose, but it's because it's overwhelmed. It's totally overwhelmed with every mental health issue that someone is presenting with. And we treat mental health as one strand. You go into one mental health department at a hospital. What about all, you know, the plethora, the spectrum of ailments and issues that we have in mental health? There's 152 other departments at my hospital because that's how specific we are with the needs of that specific issue. We need to start to expand our knowledge and understanding on that. But the difficulty in that, Gary, comes that with educating the next generation, we're changing the next decision makers. There's a gap. There's a gap now between those who are currently making decisions and those of us who I see in this room, the majority of our generation, those of us with a distinct and direct appetite to affect change, whether it's for ourselves or others, and then this new generation that's going to come through, hopefully with an inherent knowledge of the right decisions that need to be made. And it's this period of 15, 20 years, where we need to work earnestly to amend what systems are in place now without trying to retrofit systems that are totally unfit for purpose. You know, systems and research that are based on 1887 research models, 1910 research models, even 1950 research models, where what my grandparents expected as a norm is far different to what we understand and expect as a norm. So in a very long-winded way, as is my want, what needs to change in sport, in the context of support, is not looking to find a support system that fits current sporting models. We devise the support system and then we make the sports make that model fit. So we make support systems that are right for the humans, and we tell all of industry, this is the system you need to implement in your sport.
Andrea?
Oh, well, not answer that one. Oh.
No, it's just your comments on that.
Oh, well, yeah, I echo everything that was said. I think it's based on like mostly what I've said as well. So you know, it's definitely something that is much needed. And like you said, us all here in the room are the start of that. And again, and not plugging my own organisation, but just grassroots organisations like what I do. That's what we're here for, to try and reach that gap now and try and grow the younger audience to become those change makers and to have new knowledge, new experiences, new ideas, and bringing forth what is going to be our next future, because the children are the future. And so if we can all come together, whether it be grassroots, whether it be sports teams, to fight for this change, it's a great place. And having somewhere for young people to be feeling safe and not having those non-judgmental conversations around mental health, because not all mental health needs, like I mentioned before, medication. Sometimes they just need someone to talk to, and that's not always the case. So if we can again provide those spaces, I feel like this is something that will inherit that change to come.
So Clarke, I'm going to give you the role of fairy godmother here, and especially either looking at any of our major sports in this country, rugby, cricket, football, or Olympic sports. What would you do if you were the fairy godmother? What would you start with? What would be your number one in the batting order, as we mentioned in the place like this? What would be your first thing you'd do?
I've devised the system, actually, Gary.
How do you do that?
Get an opportunity for a selfless plug here. We've devised a player welfare structure that is totally independent of the coaching management structure. It's independent of any financial flows, and that's vitally important.
Well, let's start with your previous role as the chairman of the PFA. Is that an organisation which is doing its job at the moment in terms of player welfare?
The PFA is doing a job, and a job that fits what they deem is the extent of the issue and is the extent of their remit. And that falls down on many different levels. When you're talking about elite sport, there are not one single complete research or information data pack on what the current state of mental health is within sport. So we don't know what we're working with. All of those that have been conducted are a very small select participant groups, and they rely on that self-report. Now, I can tell you firsthand that when you are at the lower end of the adverse mental health spectrum and you are in depression, which is my experience, my self-awareness of that is virtually non-existent, because that place of being becomes my norm. And not only that, the very psychological factors that allow me to be an elite athlete, those that are purported by your counterparts at the sports psychology end, where failure is not an option, and fear doesn't exist, and you'll win at all costs, and blah blah, you can do anything, because that's ingrained in me from 10 years of age. Then I apply that to my own life as a human being, not just in that work aspect.
So I call that the tyranny of success, which pervades all our sports clubs. You are not allowed to say we might lose at the weekend. We are not allowed to say to any players, you're one injury away from the end of your career. That is not part of the DNA of any sports club I have ever come across.
And understandably so. It's that mindset, that narrow, closed, tunnel vision, blinkered mindset is necessary if you want to be in the top 0.01% of an industry. But it's having the ability to understand that you are more than just who football was what I did, it was not who I am.
But that's
and I was never taught that.
I'm sorry, Clarke, that still pervades the industry today. If you
definitely, 100%. That's what I'm saying is the issue. That's why we need to have a support system, an education system that runs parallel with elite sport, that is separate to the sporting and coaching model, where all of these young men, women, non-binaries are taught that they are more than just their vocational persona, that they have value and holistic value, as for myself as a son, as a husband, as a father, as a brother, as a member of my community, and as a spiritual entity, whatever that means to you. And educating people about their whole selves, educating people that Because this is another thing that pervades professional sport. It's all about external validation. From 10 years of age, how I felt about my game was utterly irrelevant. It was always what the coach thought, and then what the manager thought, and then what the fans thought, and then what the press thought. And talking about pervasive, that then fed into my home life and my relationships. So I was always seeking validation. I was always trying to earn love and compassion, not knowing that these are certain aspects that should be unconditional from those people around you who love and trust you. They were unconditional, but I didn't know it because I've been educated in this whole train of thought. But I know that now. I know the opinions that matter, and my parameters of success and failure in a day, they're defined by me before I leave the house. And I now live a life not determinant on your view of my success and failure, but on my view of looking in the mirror at the end of the day and having that contentment for who I am and the gratitude for all I have.
One senior professional footballer said to me, Gary, when one football manager has the careers of about 40 of his staff under his sole control, he can fire them, he can hire them, he can get rid of them, transfer them in or out the club. That is a recipe for poor mental health. Absolutely. So I'm going to give you the job now of a fairy godmother. So if you could change anything about sport and mental health, what would that be, Andrea?
So just echoing what was said as well about personal development within young people, I've created a framework which is around resilience, confidence and mindset. So that is something that I would like to embed a lot more into for young people, and having well-being hubs. So we was lucky to be part of a pilot this year to form a well-being hub, well-being and mental health hub for young people, and I think that that is something that is good because it educates them, it gives them that safe, non-judgmental environment, educates them on what is mental health, how to have those conversations with other people, with their families, and just with their peers as well. So for me, it will be having a space specifically for young people to be able to go to, whether it be well-being hubs or even just like local gyms. I'm a youth fitness mentor, and I have trouble taking young people to gyms. So if young people can have their own spaces where they don't need to request or go there at a certain time, because it's not a certain time that you have issues with your mental health. That could be, that could be 24 hours a day, and a young person only has between 3 and 6 to go to a local gym. I think that needs to be changed.
Many thanks. We've got time for a couple of questions from the floor for either Andrea, Clarke, Carlisle or myself. So if you just raise your hand, we'll do our best to get a working microphone to you. Does anybody have any questions for the panel before we close? Yes, I'm going to jump up there and give you my microphone there.
Hi there. Really interesting from all of you, so thank you very much. But I'm personally going to go to Andrea, because it's great that we have a professional bodybuilder up here against mainstream sports, so big up bodybuilding.
Thank you.
And can I just, round of applause, please, yeah. And it was just 3 years it took you to get the British Championship. That is amazing. What an accolade. Congratulations.
Thank you.
But what I'm going to ask is, I used to train myself, and I stopped training, and that was a really contributory factor to my eventual mental health breakdown. And then getting back into training was really important to recovery. But I just wanted to ask what you've got from bodybuilding yourself that you pass on to the people you coach, if that's not too big a question.
No, thank you for asking. So for me, it's been educating. Like I said, I work primarily with young women and girls, so educating them about being in a male-dominated environment, for one, is the main thing. 2, not conforming to the way society says that what a woman should look like, which also affects our mental health. 3, it is diet and nutrition, having a better understanding about what works for me, what doesn't, why you should drink so much water in a day. And it's really been, for me personally, it's been an educational journey being a bodybuilder. And yeah, just understanding my triggers and knowing how to handle them and how to utilize physical activity to manage my mental health and not just to become a bodybuilder.
Many, many thanks. We're running out of time, but thank you so much to my panel, Clarke, Carlisle, and to Andrea as well. Fantastic answers, fantastic discussion. And we'll be around later on if you want to come and chat with us. I'm sure that's all right. Definitely. To my panel, many thanks.
Thank you.
Thank you, Andrea, Gary, Clarke.